Botox doesn't just help with wrinkles, it can also be used to treat a variety of medical conditions.
That's interesting. So joining us this morning with details is aesthetic nurse injector Nahai Thengel. Thank you so much for joining us.
Thank you for having me.
I was a little surprised when I read, wait a second, it goes in your hair, it goes in your jaw, it goes.
Yeah.
I don't even know where to begin asking questions on this because
it is such a fun topic because just like you thought, I mean, you hear the word Botox and people automatically assume that it's related to cosmetics and aesthetics.
Yeah.
But there's this whole other realm of Botox being used for so many different medical procedures.
Wasn't it originally designed on label for medical?
It was.
Okay.
And so strabismus was just people who are cross-eyed. They actually noticed that they were giving Botox to kind of even out the eyes. And then a pro with it was that it would get rid of the wrinkles in the middle of the face. So that's actually how I got started. So many FDA approved labels for Botox: hyperhidrosis, which is excessive sweating, migraines, people who have TMJ that are constantly grinding their teeth for masseters. It can even help scalp. For Botox for the scalp can help your hair grow. So many different things. And then of course hyperhidrosis for like armpits, hands and feet and all sorts. Men's sexual dysfunction.
What?
Wow.
Vocal spasms, bladder spasms for people who have incontinence issues.
Yeah.
So many different things.
Okay, so the big thing this summer, once the movie came out, was the Barbie Botox, the Trap Tox.
Yeah,
So what is
Barbie
Trap
Botox. So if you've ever, I mean, I grew up playing Barbies, okay? And I've
course.
never really looked at Barbie, but Barbie does not have a trapezius muscle. She has this very long, feminine neck, okay, with no muscle. And so people come in and they say, I want to look like Barbie. And I'm like, well, it's actually used for medical reasons because if you have neck pain, migraine pain associated with that cervical pain, you can inject Botox and it does calm down that muscle. And so it releases that tension so you don't get those headaches. And then a pro with that is you'll have that elongated, slender, feminine looking neck. And so.
But I know with regular Botox that you put in your face, you have to go back every once in a while and re-inject.
Yep.
So is it the same for the
Same thing.
Okay.
Depending on for what you're using it for, like for underarms, hyperhidrosis, you don't have to come back every 3 to 4 months. Really, you do quite a bit of units, anywhere from 40 to 50 units per side. Yeah, it's it's a grid like we inject grid like in a very organized manner, and usually 6 months to 7 months people can get through. Maybe even 9 months. It just kind of depends. For people who are grinding their teeth, which is huge because people come in and they have all these headaches, again, related to headaches, and they'll say, please help me, and I'll feel their jaw, their masseter muscle, and it's big and hard. And you can see in this picture here, yes, her masseter muscle right here has gone down, but her face has also, her jaw, her jawline has softened. And so, people come in for one reason, and then obviously Botox is used for cosmetic reasons. So you can see it makes their jaw angular.
Sorry, go ahead.
I was saying, and when you do it for like migraines, a lot of people use it for migraines. It's like in the back of their neck, right?
You can do it in your traps. You could do it in the back of your neck. Of course, you need to go with the right people, right? So like a neurologist is somebody that you would go to for Botox for your migraines. You can do your people who grind teeth and have migraines because of that, for all the tension. You could do it in your masseters. You can even do it in your scalp, to be honest. And like people even come to me and they say, I have like frontal headaches. That I can do. I can do Botox in your frontalis and your glabellar muscles. And this lady here struggles with extremely bad migraines, and I'm injecting Botox there. And immediately, like the minute that needle goes into that thick muscle, because it's hypertrophy, right? It's big because you're constantly grinding, so that muscle is getting thicker and stronger.
Yeah.
There's this instant relief. Like people are just like, oh my gosh, I feel that relief. It just kind of pops.
So talk to me a little bit more about the scalp growth, the hair growth, because this is like, I know there's a lot of women and men, obviously, but there's a lot of women that start losing their hair as they age. So how does it work, and does it work? What's the success of it?
It's amazing. So there's not one treatment that treats all, right? So like this is part of my hair loss treatment that I do. And so you do Botox in the scalps because what it's eventually doing is it's calming down those muscles, the sweat glands. It relaxes those muscles so more blood flow can go in.
Wow.
And so that's supposed to help with hair growth. And then you do it in conjunction with other therapies like PRP for hair loss, stuff like that. And then again, people who sweat in their scalp, it kind of all goes in together. Yeah, like for my men that come in, they'll say, I want to grow my hair, but will this help with my sweating and my scalp? Absolutely, it does. Kills
multiple birds in one stone.
absolutely,
Right,
yeah.
Oh my God, and it looks like such a small needle because I'm like in my head that would freak me out.
Such small needles, much small doses. It is a lot of pokes, but it's itty bitty.
Itty bitty. Wow,
Yeah.
that is crazy. Yeah, so you're not doesn't mean you're necessarily just worried about your looks when you go to get some Botox.
No, I mean, there's so many different things on it, and when I tell people that, they're just like, wait, what?
Yeah.
It could do this? It could benefit me here? What? So many different reasons.
Awesome,
That's great.
Neha. Thank you.
Thanks for having me.
Yeah.
And if you want to get Botox anywhere, apparently, you can you can talk to Neha. Here's all of her information right here. And wow, great stuff there.
Thank
Thanks.
you.
Thank you.